moving swiftly on, we have the next session is short oral session. We are gonna begin with Dr. Suyanee Thongchot, and her topic of talk is anti-TROP2 CAR T cells secreting anti-nectin-2 scFv effectively kill high TROP2 and nectin-2 breast cancer cells. So please give a round of applause to Dr. Suyanee from Mahidol University.
Again, good afternoon, everyone. My name is Suyanee Thongchot from Department of Immunology, Faculty of Medicine, Suyanee Hospital, Mahidol University. Today, I will present some part of my work in the title Anti-TROP2 CAR T cell secreting nectin-2 scFv effectively kill the high TROP2 and high nectin-2 breast cancer cell. So, briefly about the triple-negative breast cancer or TNBC. TNBC is the most aggressive form among breast cancer subtype with no ER, PR, and HER2 positive expression. The treatment of TNBC usually include the surgery with the chemotherapy or radiation. Unfortunately, patients with TNBC has higher rate of recurrence. So now there are several new and ongoing studies looking for the treatment for TNBC. And you can see here the immunotherapy is a new type of therapy which may lead to the better outcome for TNBC patient. Sierra Center of Research Excellence for Cancer Immunotherapy, or we call in short CAT, led by Professor Pethai Yenjit Sumanat and also Associate Professor Dr. Mutita Jungkin. And our Department of Immunology, Professor Dr. Chanitra Thuwajit, Associate Professor Piti Thuwajit, and I have collaborative project with CAT. We try to develop the knowledge and technology used in a immune cell based therapy, including the this is here the dendritic cell-based therapy, peptide-based therapy, the CAR T cell, or we use the bispecific T cell engager, or we call BI, and bispecific T cell engager, or bi-arm to T cell, we call BAT. And the last one, new coming, that we engineer the CAR T cell to secrete the BI, we call INK T cell. But today my presentation is focusing on the chimeric antigen receptor or the CAR T cell. And the tumor antigen that we use in this study is the TROP2. TROP2 is which highly expressed in Thai TNBC patient tissue checked by Dr. Cherumchai from CAT. Dr. Cherumchai reported last year the success of the anti-TROP2 CAR4 T cell that you can see here. The CAR4 consists 3 co-stimulatory molecules, including the CD28, 4-1BB, and CD27, joined with the CD3 zeta here. And this CAR T cell exhibit the potent cytotoxicity against breast cancer cell with both, you can see the 2D and 3D list here. Moreover, he report this CAR T cell enhanced cytotoxic secreting. It describes, for example, the TNF alpha, interferon gamma, and also the GAN-SAM B when exposed to the TROP2 positive cancer cell. But as everyone knows, the key reason why the CAR T cell therapy is limited in the solid tumor. The key problem is the tumor microenvironment that have high immunosuppressive problem that make it challenging for the CAR T cell to survive, to proliferate, or do the function of the killing in the solid tumor. So to enhance the CAR T cell efficacy, we have to block this checkpoint pathway. And several studies also discovered that blocking the binding between PD-L1 and PD-1, but now they have report about the blocking of binding nectin-2 and its receptor, for example, the TIGIT, can allow the T cell to kill the tumor cell. From this rationale, we generate the anti-TOP2 CAR T cell with the ability to secrete nectin-2 SCFV and evaluate their function in vitro or in preclinical study. So before study, we confirm the important role of nectin-2 and TOP2. We performed the immunohistochemistry, showed TNBC patient with high TOP2 around 56% and nectin-2 around 62%. And the important that the patient who have both high nectin-2 with TOP2 around 14% have the significantly correlate with shorter outcome when compared with the group of low nectin-2 and low TOP2. And here we show the successful production of the anti-TOP2 CAR T cell with anti-nectin-2 SCFV secretion. You can see here the TOP2 SCFV joined with the CAR4 that consists of 3 costimulatory molecules, CD27, 4-1BB, and CD28. And you can see here we join together with the anti-nectin-2 SCFV. And we show here we have got the correct sequencing, and also we have got 3 clones that show successful protein production by Western blot of the CD3 zeta here when compared with the untransfected cell. And also we check the nectin-2 secreted in the supernatant and also in the cell line. You can see our 3 success clones express the nectin-2 that tag with HA tag in both in 3 clones with when compared with the untransfected cell. And to assess the binding activity of the secreted nectin-2 SCFV, we show the supernatant from our culture can bind to the nectin-2 highly expressed breast cancer cell. That you can see the signal is around more than 90% binding. And this binding can confirm by the inhibitory activity from the antibody, monoclonal antibody nectin-2 can block this binding. That means in the supernet of our culture, CAR T cell can secrete the nectin-2 SCFV in the supernatant. And finally, we confirm the anti-TOP2 CAR T cell secrete nectin-2 demonstrate the specific cytotoxicity against TOP2 nectin-2 double positive TNBC cell. That you can see here we use the MDMB231 and MDMB468. That you can see our CAR T cell, anti-TOP2 CAR T cell with the nectin-2 SCFV secrete. You can see it have the highly killing effect in both the 2D and also in 3D when compared with the mock or the untransfected T cell, or compare with the TOP2 with no anti-nectin-2 secretion. Okay, and finally, I will conclude that patient with high TOP2 and high nectin-2 is around 14% significantly correlate with the shorter outcome of TNBC patient group, and we show the successful production of TOP2 CAR T cell with secretion of the nectin-2 SCFV, but our result from now just demonstrate for the proof of concept for use the anti-TOP2 CAR T cell secreting nectin-2 SCFV may be proposed to the potential strategy treatment for the breast cancer patient who have high both nectin-2 and TOP2 expression. Thank you.
Thank you very much for your interesting presentation. So this is Q&A stations. So if anyone have questions, please approach to the microphone. If no, may I have one?
Okay,
Actually,
please.
so can you give can you give a comment on, comparing between the immune checkpoint you use in this presentation, the Nectin-2,
Yes.
comparing to the PD-L1
Ah,
in the context of breast cancer, triple-negative breast cancer?
sorry for the rationale to use, right?
Yes, I mean, for now, we focus on Nectin-2, right?
Yes.
But I'm familiar with PD-L1, so I just wondering, so whether these PD-L1s Nectin-2, so which one is more interesting in the context of maybe breast cancer or another solid tumor cancers?
For in the role of the immune checkpoint inhibitor or the function role, I think it's the same, but it depends on the percent or the positive of the patient have. It depends. Because now in our center we have both the CAR T cell that can secrete PD-L1 SCFV and also the Nectin-2 SCFV. So it's just like the choice for treatment for the patient who have high Nectin-2 or PD-L1.
Okay, that's nice to know. So we can basically starting from screening
Yes,
which
yes.
one is more expression
Yes, yes,
between
Ka.
PD-L1s,
Yeah.
Nectin-2, and
Yeah.
we can choose.
Yes.
Great. So thank you very much.
Thank
Very,
you. Ka.
very nice.
There any other questions? Okay. Can I have one more then?
Okay.
Maybe I missed this. If I do, I'm sorry, but did you look at the specificity of Nectin-2 on normal cells?
I see. I'm sorry that, can you show my slide again, please? Okay. At here you can see in the MCF10A, I'm sorry, that is a breast, normal breast. We can show that there is a negative Nectin-2, and also that when we use this, it's no effect for the MCF10A. And for the killing, I have also performed in this cell line also, but not shown in this slide. It's no effect to the normal cell.
Okay.
Yep.
Okay, thank you so much.
Thank you.
So if there is no more question, thank you very much,
Thank you.
Dr. Suyanee.